Hi, in this video I'm going to be talking about the use of CT scanning in trauma. So one of the things that you have to consider is which patients do you want to perform a CT scan on in a trauma setting? And the answer is all of them, or near enough. Most patients who receive a trauma team activation in a hospital will also receive a CT scan, because there are a number of different injuries that can be suffered by a trauma patient, which are not always immediately obvious. So CT scan gives a good idea of the injuries that are present within the body, and it can be done very quickly. Now, there are some patients who you wouldn't perform this in. So these include your patients who have clearly very superficial injuries. So this might be a patient who's come in to the trauma hospital with a stab wound, which when you look at it is on the shoulder and has only made a small incision. So this is something that you can easily close yourself. Another is a patient who you don't think will survive long enough if you go to the CT scan. So you might choose to go straight to theatre, and that's obviously only possible if you've got a surgeon who's willing to operate on a patient without knowing exactly what they're going to find when they perform the exploratory laparotomy. And patients who are pregnant or suffering from renal failure also can have problems from the radiation exposure or the use of contrast during CT scanning. So these are patients who you might want to consider if there are alternatives to using CT scanning. However, if it's necessary, then it still will be performed. So patients with a head injury will typically receive a CT scan of their head. And what you'll be looking for are things like extra or subdural bleeds. So these will be your lentiform or crescent-shaped bleeds. Subarachnoid bleeds, where you can see the blood present within the CSF, or contusions, which is essentially bruising present within the brain tissue. You can also have a look for skull fractures and swelling around the head. And then these can all lead to coning, which is where you have things such as herniation and increased intracranial pressure, and this can be noted through things such as a midline shift on your CT scan. So then you have your CT cap, sometimes referred to as a trauma scan or CT chest, abdomen, pelvis. And this is what's performed on most trauma patients, particularly if they've received a blunt injury, as this will give a quick, almost top-to-toe view of what's going on inside the body. So in the chest, you're looking at the ribs and seeing if there's any fractures. You're looking at the lungs to see if there's any air present in the pleural space or if there's any bruising on the lung surface. And then in the heart, you're looking for if there's been any penetrating injuries to the heart from, for example, rib fractures, or if the aorta has an aortic dissection, which is common in acceleration-deceleration injuries. Then in the abdomen, you're looking predominantly at the spleen and liver. They're the two major sites of bleeding within the abdomen. And then the kidneys can also be sites of bleeding, or maybe sites which have received ischemia from the decrease in blood pressure in a bleeding patient, and so it may be obvious that there's an acute kidney injury. And then in the pelvis, you're looking for either actively bleeding vessels or the presence of hematoma, which suggests that there's an ongoing bleed in the pelvis. So a CTA, or CT angiography, is where dye is injected into the vessels in order to make them more obvious. So this is done to understand whether or not the vessels are patent and whether or not they are bleeding. So in a head injury, if there's dye present in, for example, a subdural bleed, then it suggests that the bleed is still ongoing, and so it's just going to get bigger and bigger and bigger, and so it requires rapid intervention to prevent coning. In the torso, having a look for dye, well, this can suggest to you where the bleed is coming from. So you might know that there's a pelvic or abdominal bleed, but you don't know which one it is. Well, this can provide you your site of the bleed, and so might guide your decision about whether to go to theatre or interventional radiology. And then in limbs, CT angiography is used to determine whether or not the vessels are still intact, and therefore guide whether or not a surgical procedure has to be performed in order to prevent distal ischemia. Because if the vessel is ruptured in the thigh, then there won't be any blood reaching the foot, and so this has to be corrected surgically. So this is a basic understanding of how CT scanning in trauma works and what it's used for. And then there are further more complex things, and it's important also to be able to understand how to interpret CT scans. Thank you for listening.